So people always ask me what's the difference between a medical history and a functional medicine history or integrative medicine history. And there's a lot to that question. So in a medical history, for example, you're getting your past medical history, your past surgical history, social history, and family history. These are very standard in the conventional medicine model. The past medical history is a list of your diagnoses. The past surgical history is basically what surgeries you've had. The social histories, do you drink, do you smoke, do you use any form of drugs? Family history is usually, what kind of family disease processes are in your family. Pretty basic, very useful for the right circumstance. When you're talking about a functional medicine history, you're talking a deeper dive into different aspects. Like, for example, there may be questions about birth issues. Were there any childhood major events that happened in your life, both positive or negative? What are your family patterns of disease? Did you have antibiotics when you were growing up? And how often? Where did you grow up? What kind of environment were you in? Were you in a farm? Were you in the city? Were you in a small town? Were you in a different country? How do you eat? How do you eat now? How did you eat before? What are you used to eating? What are your favorites? What kind of stressors do you have? And how do you respond or react to them? What kind of supplements do you take? How do you sleep? How do you center yourself? What kind of practices do you have that help you calm or stay centered? That help you become more responsive in the world as opposed to more reactive in the world? What's your spiritual health? How do you feel about your spirituality in terms of how it orients you in your life? Questions that are very appropriate from the perspective of an integrative intake of a person's well-being. And where, this is again not to say one is better than the other. The conventional medicine history is perfect for when it's doing a very acute care model and is trying to take care of something that's going on right then and there. But when you're talking about an integrative, holistic, well-being approach, these are the kinds of questions in histories where the more deeper you get into, the greater the sense of well-being that can arise as a result of this investigation. Thank you.